Hi, good evening, everyone. I would like to thank APO and AIOC for giving me this opportunity. So here you can see the title of the study. This is novel FFA findings, which we were trying to look at in cases of bacillary layer detachment in active VKH disease. This is the slide which we all are familiar with, that is VKH being a rare and an autoimmune disorder affecting multiple systems, as you can see, primarily the eyes, the skin, and the central nervous system. Bacillary layer detachment, which was first described in a toxo case, can present in multiple types of disorders, be it infective, be it inflammatory, and others as well. Now, that the thing which we all know, that OCT is one of the major or the most important investigation modality for diagnosing bacillary layer detachment or ballot. So if you look at this slide particularly, what we found in literature, the definition of ballad is this is the split of the inner segment of the myoid zone. And if we have to compare it histologically, that is correlating to the photoreceptor layer inner segment. So now ballad is very much a recognized entity in VKH. What we were trying to analyze was that is there any other investigation modality for VKH apart from OCT, and are there any other features which we can look at? So the lacunae, what we had in literature was that the angiography is one of the most important and the diagnostic criteria for VKH. So if we have to have some insight about the clinical activity as well as the functionality of the retina and the importance of bacillary layer detachment, because it is called as a prognostic marker, we need to find other investigation modalities as well. So for that, and because of paucity of literature, we went on to see the fundus fluorescein angiographic findings as well as the fundus or the clinical pictures of bacillary layer detachment in VKH. That was our main objective here, to see FFA based features and fundus photo. We had collected a case of almost 20 cases, which included almost 31 eyes. This was a retrospective and a descriptive study and a cross-sectional ones, because we had presented or taken cases of acute onset VKH only. And this was approved by our in-house review board. This spanned for almost more than a decade, that is 2014 to December 2023. If we had a look at the inclusion criteria and the exclusion criteria, we included patients with sun-diagnosed acute VKH patients, and this was only on OCT, which were having bacillary layer detachment and which had FFA findings as well as fundus photograph. We excluded all those patients who were acute onset VKH but did not have any bacillary layer detachment on OCT, or those who did not have a proper fundus photo or a proper clinical photo. FFA images were underwent a blinded single personal review by a Uvea faculty member, and then later on see the OCT images as well. They were randomly evaluated later. If you have to see the results, 20 cases were having 31 eyes in total. Mean age was 35.65. We had an equal number of males and females included, and laterality were having 9 as unilateral and 11 as bilateral. This is the detection of bacillary layer detachment on fundus photo only. More number of having fundus photo and FFA both. The last but not the least, at least less than 10 patients having only on FFA. If you have to look at the fundus photo patterns, an ill-defined circumlinear line was present. I'll show you the fundus photo also. Here is what we were looking at on the fundus photo. This was a circumferential kidney-shaped kind of a line, a distinct line, which was we were trying to look at and which we were thinking as bacillary layer detachment. This was another kind of a line, but it was not that distinct. So this is what another feature is what we have to look at on the fundus photo. Another representative image of fundus photo having a bacillary layer detachment is this partial circumlinear line. If we have to look at the main thing now, that is the fundus fluorescein angiography features, we had a well-defined hypofluorescent line with an intense hyper. This was again seen in multiple patients. FFA having hyperfluorescence with inner moderate to high hyperfluorescence. The other one was a zone of hyperfluorescence. So this was another finding on FFA which we were trying to look at. This was almost more than 10 patients in the counted number of patients. Limitations was a small sample size, retrospective nature. Only one person had reviewed. Follow-up cases were not there. to conclude, angiography, yes, is one of the gold standards, can be used as a diagnosis. Ballard is an angiography active entity which we need to look at. Thank you for your place in listening.
Thank you, Dr. Vishal, for that additional information on angiography. That line which you showed on fundus photo is probably the septae which is separating the serous detachments of VKH,
Yes,
I guess.
I think that was one, but apart from the septae, the difference between the neurosensory detachment and that having an extra bacillary layer detachment was a quite distinct and a thickened line, which we were seeing on fundus photo.
Fundus photo.
Apart from that, if we have to correlate it with on fluorescent angiography, that was also having a few hypolesions like what we had apart from the pinpoint hyper or late hyper which we get in VKH. Apart from that, we had that line corresponding to the fundus photo as well. So that was one of the things, but of course we did not have much of a follow-up data, which would be much beneficial if you have to track these patients just based on the FFA findings only.
Okay. Thank you.
Thank you.
Thank you, Dr.